One of the most important and commonly used things in the ED is of course the CBC or the complete blood count. It gives you a lot of values and results that are very important and can diagnose a wide variety of conditions. The first thing that we look at is the WBCs, and these white blood cells should range from 4,000 till 11,000. Of course, leukocytosis indicates inflammation or infections, but they can also be high in cases of stress. And when I say stress, I mean physical stress, like in patients with sepsis or trauma. And they can also be high in cases of leukemia. Although in leukemia they should be very, very high. Like if you have an infection, for example, like UTI or acute calcular cholecystitis, WBCs would range from, let's say, 11 till maybe 18 or 19. But in cases of leukemia, they can be as high as 50,000. And leukopenia is seen in cases where there is a problem in the bone marrow itself. The red blood cells can vary between males and females. Having too many blood cells, or polycythemia, indicates dehydration or cardiac issues, because if the body doesn't have enough oxygen, it will produce more blood cells in effort to increase the oxygen delivery. And this results in polycythemia. This is seen in patients who live in high altitude, severely obese patients, patients with interstitial lung disease, or obstructive sleep apnea. And of course, if you have low count, this indicates anemia. And this is most likely due to iron deficiency anemia, but it can also be caused by other issues like kidney disease or bone marrow disease. Hemoglobin is one of the things that we always look at when we order CBC. It is very important. And again, the range differs between males and females. High levels are not really worrying or alarming signs, and they can indicate dehydration, lung disease, or polycythemia. But low levels are very important because they can indicate blood loss or bone marrow problems or anemia. You need to have hemoglobin levels within normal limits for the patient to respond well to any treatment that you give them, especially if you're going for surgery. Hematocrit is basically how much blood cells you have within a given sample, and this again ranges between males and females. High levels indicate dehydration or polycythemia, and low levels indicate anemia, blood loss, or bone marrow problems. The mean corpuscular volume indicates the average size of the individual red blood cells. This should be between 80 till 100. And for most patients, if the number is too high or too low, the patient will be anemic. So high number indicates a larger red blood cells. Large red blood cells, like macrocytic anemia, is seen in patients with folate or B12 deficiency. And smaller cells or microcytic anemia is seen in patients with iron deficiency anemia and thalassemias. This one is very, very important, and you need to know this page very well. And the mean corpuscular hemoglobin concentration indicates how much hemoglobin you have in each red blood cell. And this again indicates the levels of anemia. Too high or too low indicates anemia. Because if you have larger or smaller cells, you will have more hemoglobin or less hemoglobin. And finally, we look at the platelets, which can indicate coagulation problems, and if you have too high or too low, this can cause problems in the patient, either forming too many clots or too little. This lecture is part of the emergency medicine course. If you find it useful, you can check out the entire course in the link in the description. The course covers everything that has to do with the emergency department, including tests, imaging studies, common cases, and serious conditions. We also have a lot of cases and quizzes that you can take to test your knowledge. Just check the link in the description.